Minister, can I first of all welcome the opportunity to have a discussion today on safe staffing in our hospitals, and start by saying that last summer was the first time that we had a very serious problem in our hospitals, where we talked for the first time about a summer trolley crisis. And before that summer trolley crisis arrived, we had a health service and people who are working in our healthcare systems right through primary care, acute care, community care, who were flat out during COVID. They had the cyber attack, and even long before COVID were telling us that they were burned out. Along comes the summer with some hope of relief for those on the front line, and it didn't come. In fact, we had very serious overcrowding in hospitals for the first time in a very serious way last summer. That continued right into the autumn, as you know. It continued and got worse into the winter, where we had possibly one of the worst winters on record, exacerbated, yes, by the lack of capacity in the system, but by that mix of illness that we had circulating in the community, which put enormous pressure on our frontline healthcare system. And over the last number of weeks, and we're now going into April, but certainly for most of March, we had, on average, about 500 patients on trolleys every day. In fact, last week, there wasn't a day that the number was less than 600. And it seems to many people who work on the front line in healthcare that this has become the new normal. It's acceptable now that for every day, every week, every month of every year, we have to tolerate that level of overcrowding in our hospitals. And there's lots of reasons for it, and we've had many discussions about why we have the levels of overcrowding that we have in our hospitals. Partly we don't have enough beds in the system, partly we don't have enough staff in our hospitals, partly we don't have the primary care that we need, the out-of-hours GP care, partly it's because we don't have the community care and the community infrastructure, and so on. So we know there's a lot of reasons why we end up with the crisis that we have in our emergency departments. But unsafe staffing is one of the problems. And if you talk to any hospital manager, and I've spoken to most of them now, I would imagine at this stage, they will say it's surgical theatre capacity, diagnostic capacity, bed capacity are all really important, but none of that's possible without staff. Over the last number of weeks and months, we've had threatened strike action from the Irish Nurses and Midwives organisation. So you spoke at length about all of the things that you have done and your government have done. But while there has been additional staff and there has been additional beds and there has been movement towards universal healthcare and the new consulting contract, which of course I welcome, and many of the positive developments which have been put in place, of course I welcome. The backdrop to this discussion today is that we have seriously overcrowded hospitals, patients in record numbers on trolleys, people over 75 in hospitals in Cork waiting on average 40 years, over 40 years in 1 month last year in our acute hospitals in Cork. That's the backdrop. We have people who are waiting for access to care, people who are on healthcare waiting lists, and all of that is a product of a system that doesn't seem to be working, despite all of the resources, despite all of the capacity that you talk about. It doesn't seem to be delivering the levels of care at speed that needs to be delivered. And I think you would accept that the waiting times are too high and that the length of time people are waiting in emergency departments is too high. So once and for all, and I've said this to you in the early days of January, when we first came back and we had a discussion about what was happening in the hospitals, we had to take what happened in that winter, going back to last summer, as a watershed moment in healthcare. That once and for all, we as an Oireachtas are going to say we're not going to tolerate that levels of overcrowding in our hospitals, and it simply cannot be accepted as normal. And the only way we're going to be able to deliver on that promise is to put the capacity in, and part of that is staffing. So you talked a lot, and I've listened to what you've said over the last number of months. You've talked about doubling training capacity so that we can train more healthcare professionals, and I would support that. And it shouldn't be about a competition about numbers. You say double, I say more or less, or whatever it is. It has to be based on what we need. So in my view, we need a new workforce plan and a new workforce strategy that's actually underpinned by what does the healthcare system need. And we have the science. So the Safe Staffing and Skills Mix framework should tell us what we need in terms of staff across wards, in hospitals, in emergency departments, and then we roll that into community services and primary care as well in terms of HSE and public staff. The Irish Nurses and Midwives Organisation have, in my view, justifiably asked you and your government to underpin that framework by legislation. And that would mean then that the state and you as Minister would be legally obliged to provide safe staffing levels in hospitals. That's something that I am committed to. So I can clearly say in this chamber today that if I was sitting where you are and if I was the Minister for Health, I would introduce legislation to underpin that framework in legislation. Because that's the science. That tells us what we need. And obviously that will change based on demographics and based on the additional capacity that we put into healthcare. It doesn't deal with all of the problems, doesn't tell us everything, because it's only based on what capacity we have in the system. That's what it's based on. But at least it's a starting point, and it should be underpinned by legislation. So can I say to you, Minister, that unless we have a workforce plan that is of substance, talking about more beds, talking about more capacity in the system, talking about all the other capital investment and any other investment that we want to put in healthcare will come to nothing, because we can't open beds without staff and we can't put the capacity into our hospitals that we need without staff. At its core, healthcare is about people treating people. That's what it's about. It's about healthcare professionals, frontline healthcare workers treating sick people, and we need more of them, and we won't have more of them unless we train more, unless we have more placements, which is also important. We can't just increase training places and then not have the placements in healthcare settings, so that we can actually make sure that they can get, yes, the training, but also the placements. And of course, we need the investment to make that happen.